It's not the same test in all labs. We use a far different test. The universities use a different test. They're all approved tests. But the CDC was only doing it for the labs they oversee. So it was just, it only affected the small. It caused a flurry, I get it. It caused some intellectual confusion, I get it. But just for clarity, it wasn't something nefarious they were doing. It was just more for tracking.
Do masks stop viruses?
Well,
I can answer that.
There's a right answer.
You know, technically, I mean, a surgical mask, a cloth mask, no. An N95 worn properly by two medical professionals for a brief period of time interacting, you can decrease viral load. But the virus is, 0.1 microns. Even a hole in an N95 mask is 0.3 microns. You cough just a little bit, and just by fluorodynamics or movements or whatnot, you blast those pores open, and now you can't stop it. So, I mean, I understand people want to do something. It's a public health measure. If you look at all the randomized controlled trials on masks and airborne viruses over history, there's not one. You know what works? Stay home when you're sick. Number two, stay home when you're sick.
Yep.
Stay home when you're sick.
Thank you.
Wash your hands, wash your hands, wash your hands.
Yes.
This guy's had his hand up.
Yeah, so if we get COVID, we build up a long-lasting natural immunity. What happens if you get the vaccine and then you get COVID? Do you still get that long-lasting immunity, or does the vaccine negate that at all?
No, in theory, immunologically, you should build that broader immunity now. Yes. But beyond that, you don't need to be boosted beyond that, because then you're going to get into that high zone tolerance effect. So you don't want to mess with it. So, you got the shot, you still are susceptible to Delta, absolutely. Once you get through Delta, you should have a broad natural immunity.
So they're just for clarification, in patients that suspect they had COVID and survived it but didn't get tested, and then went on to get 2 shots, so they completed their vaccination. When those patients have their antibody assays done, if they're positive for antibodies, how can they know if the antibodies are because they had COVID or because they vaccinated?
Yeah, we can check in the laboratory 2 different types of antibodies. So the vaccine gives you a spike antibody only, and a natural infection, there's a little nucleocapsid that surrounds the mRNA. And your body will make antibodies to that for a natural infection. So we can tease the 2 out in the laboratory setting.
And when you get the report, how is it delineated on the report?
You'll see spike antibody, nucleocapsid antibody. So you can distinguish the 2. All right, in the middle there, wave in the cap.
Thank you. I have to go to the VA in a couple of weeks for a routine appointment, and I have to get a COVID test. But I don't want them to jam the straw up my nose. Is there another procedure I can go through, maybe at your office or somewhere else?
We could clip your toenails. No,
I can't hear
the approved tests are nasal tests. There's some spit tests as well that you can send off. So if you need to get a test, the standard test is if the virus is present, it's going to be in your mucosal secretions. So the test you want to get, as uncomfortable as that, it tickles. I mean, if you do it right, it shouldn't hurt. So anyway, there's some rapid tests coming out too that are going to be shorter and quicker. But you need the test. Sorry.
I'll use my teacher voice.
Okay, teacher.
COVID recovered.
All right.
I'm taking care of people.
Very
And
good.
so far, so good. Keeping my vitamin D level up, all of that. But where can people go here in the valley for early treatment? I mean,
Yeah.
I heard about the monoclonal.
Yeah, the monoclonals, let me mention the monoclonals. Where do you go for early treatment? And this is something that is FDA emergency authorized. Monoclonals in a good percentage of people can be very life-saving. Now, because Delta replicates so fast, what an antibody does is it binds and neutralizes the virus, and then your immune system clears it. So with Delta replicating fast, if you're going to get monoclonals, get them early. And I want to commend, the government's looking at early treatment centers here now. Good, Good, and I commend the state for looking at that, that's wonderful. The monoclonals can decrease hospitalization and death by 50% if you get them on board early in the first 1 to 7 days. I would recommend test and treat, don't even wait. So beyond 7 days, then you go down to like 20, 30%, don't quote me exactly, fact check .org. But it does decrease rapidly once you get into that inflammatory stage of the disease where the virus is already maximally replicated. So I'm glad that there's going to be more available here. Test and treat, whatever early treatment you can get on, that's wonderful.
But where?
Well, unfortunately, right now it's only in the emergency rooms.
When did that start? Just recently? Did that just start?
Here's the sad part about it. These have been available for a long time, months and months and months, since last year. Eli Lilly got their $1 billion and parked them everywhere they needed them, and nobody's advertised them. And that's a really big question. We've had an early intervention sitting on the shelf being ignored. It's frustrating. It could have saved a lot of lives early.
Doesn't AFLDS have a list of doctors who does that?
AFLDS.org has a list of doctors, myfreedoctor.com, speakwithanmd.com, a lot of online services, early treatment. Now, give them some grace because with Delta, they are overwhelmed right now. I've talked to a lot of my colleagues, and they're overwhelmed with requests. And then with the government restricting some of the safest, most effective drugs on the planet Earth that are not cocaine, it's not. I mean, these are safe antiviral and inflammatory medications that have been used for 35 and 70 years respectively. So yes, that's one of the websites, and there's a couple others, and there are doctors around the country willing to early treat and save lives. We take an oath to the patient, and our job is to save a life.
But there isn't really anyone locally that.
Not a whole lot, unfortunately.
Mine Mark Star.
Yeah, talk amongst yourself afterwards. We're going to try to establish it tonight. A bunch of doctors are getting together.
Good.
And we may beat the government to the punch.
Good.
So keep your ears open on that.
Thank you. Andrew with Channel 7. Talked to Health and Welfare this morning. They cited a study from, I think, the state of Kentucky Health and Welfare along with the CDC. And it actually differentiated from a study that you showed today. It said that people who have gotten COVID already, who get vaccinated, are, I think, half as likely to get COVID again.
Yeah.
I'm not saying that you're lying or wrong. Just help me understand, as somebody who is not an expert, how the two different studies have completely different.
Yeah, let me send you a critique of that study because there's some data manipulation in that study and it wasn't well done. And again, if you're forming an you had COVID, you recovered, you have a good broad array of antibodies. Now you're preferentially ramping up one. They're looking at, oh great, look, we've got more antibodies. That's not as important as the breadth of your response. So now you're hyper-focusing the response into one area to the detriment of a broader response.
Could you, I know this is super difficult to do. A lot of people who are going to be watching our show today are not experts, and those are words that I don't understand. A lot of our viewers don't understand. What's a really simple way to break that down and dumb it down for people like myself?
All right, on a football field and you're blocking against the opposition, do you want 8 or 9 blockers or do you want 1? That's how we break that
And
down.
how would their study suggest that 1 is better than 9?
Because they're looking at the strength, they're focusing on one response, they're measuring one response. So it's what you measure, and you can't see what you don't look for. So if you're looking for this and saying, great, we found that, well good, you found that, but are you looking at the breadth of that T-cell response as well? Are you looking at the breadth of that that bicycle basket in the back tire in the seat as well? Or are you only looking at the front tire in that study? And so that's one of the critiques of the study is, yes, you're forming a stronger antibody, but when you break it down by population too, so if you look at that Kentucky study, you have to look at population statistics and in which age group was it most beneficial and which age group. So when you go into the data charts of these things, I never read a conclusion of a paper without reading all the charts in the paper, because very often they want it to conclude something, and if it didn't, they'll still put their conclusion there. And then I read down the data charts and I go, all right, statistically, it sure seems different to me. And I'm not saying it's good or bad in that paper. I think, they tried to do some certain things quite well, but I'll get your number afterwards because I'm going to send you the critique to that paper.
I gotta go for a deadline, I'm gonna give you my number.
So, I get the paper to you by deadline, but I'll try.
Appreciate that.
Thank you. Oh, thank you. Thank you. Thank you.
I've got one straggler at West Data, and I went through the transcript at the most recent school board meeting, and Dr. Bob said, we'll work closely with our hospital community. And I wondered, are they doing an end run around you?
I don't know, you'll have to ask them. About Central District Health, at least an opinion to be had. So again, I invite my colleagues, Dr. Kate, anybody else who wants to sit down, cordially build a bridge, have a conversation. I'm here to stay, I'm here to help the community. Let's be friends.
Yes.
Good.
Yes, thank you, sir. I want to clarify something you said before earlier during your speech. Were you saying that vaccines are only for you, they're not for the general population? I mean, only help you, they don't help the general population?
I never take a medicine for you, I take a medicine for me.
Okay, sir, do you have a smallpox scar?
Do I? Yeah, and I never got smallpox.
You have a smallpox scar. How many people here?
Oh, smallpox scar, no.
I do not have
no.
smallpox.
I'm a little too
You
young.
don't have smallpox.
Yeah, no, I don't. But people mischaracterize me. Oh, you're anti-vaccine. No, I'm not. I'm not. I got all my shots. I've had my childhood shots, my military shots. I don't even know what Uncle Sam started me. Vaccines have been one of the very, very good public health measure over the years, in addition to sanitation and clean water. So, look, your body, your choice. Fully informed consent is what matters most.
You mentioned vitamin D a lot, and I have trouble finding out what a good amount of dosage is.
Okay, the best way to know how much vitamin D to take is the question. And it depends, everybody's body is different. Your best way to get it is get outside in the sunshine. Now, when you get into fall and winter, you want to get your vitamin D levels higher to avoid, you still get flu and cold, but it can decrease the severity of that. But a level, the Endocrine Society says you can safely take 4,000 international units a day without getting tested. Now, if you have darker skin, you may need more. If you're slightly obese, you probably need more because vitamin D is stored in your fat in your body. To take vitamin D, you should take magnesium at night. Most of us are magnesium deficient. Magnesium moves the vitamin D from your fat into your circulation and helps it work even better. And vitamin K2 is critical as well, just to keep your calcium balanced. Yes, ma'am.
What is the absolutely highest quality, most absorbable way to take D?
Just make sure it's a good quality made one. I just try to make sure it's made in America. And so you probably know what you're getting. I'm not going to advertise any brand. I'm not selling anything, but just find a good quality one. You can read reviews and you can read where they're made and things like that. And, okay. All right, sorry. Then you.
Thank you. Dr. Cole.
Yes.
I want to thank you personally for your studying, your intelligence, for all the work that you're doing, and especially for being courageous. We're talking about a virus here that most of us can overcome, and it affects 2 weeks of our life. The thing I want to thank you for, and I honestly believe that you'll be a key soldier in the fight against the final variant, which is communism. Which will have a bigger effect than just 2 weeks or a month out of our life. it will take us forever to get it back. So
Yeah.
thank you for standing up, being brave, not afraid. We need people like you.
You know, I have nothing to gain from what I'm saying, what I'm doing. You know, I've lost clients, I've been criticized, I've been torn down in the media. The only reason I'm doing this is because it's the right thing to do. I always reserve the right to be wrong. So if somebody else knows something, teach me.
Yeah.
One more question.
Right here is
Yes,
not
ma'am.
standing up forever, this guy.
Oh boy, I already turned her down twice. God blind date, I'm sorry. All right, go ahead, and then you can ask your doctor.
So, there's been a lot of us are here, and we support you. I personally helped you get your position, and congratulations on that. There's been a lot of us are I'm to address the blue masks, the ones of those cheap or trying to make materials that they hand out to our students in schools and grocery stores. What you would say, people are saying that the material is causing cancer.
Yeah, I don't know the answer to that. I really don't. I mean, having a fiber that's irritating causes inflammation. It's not good.
Because they say that it causes cancer, and we know it doesn't protect against COVID. The box that those masks come in literally says it does not protect against respiratory illness in the tiny writing.
Yeah, I mean, there are some good masks and bad masks, and you choose a mask, choose a quality one. I don't know the answer without long-term stuff.
Particles are a mosquito, and then the
Made in America.
There you go. All right, well, it looks like my time is up. I'll stay and answer a few questions after, and I've got a bunch of patients I've got to take care of after this as well. So thank you so much for your time.